This is my spine. It holds more than metal rods and screws. It holds pain, constant, grinding, exhausting pain. And I have really struggled with how to describe that to practitioners because being autistic, sometimes I struggle to describe how much pain I'm in. Words like sharp or dull don't always really fit. And I can get a little bit blurry when it comes to timelines, how long I've had it, when it started, like, because it impacts how I remember and receive information. It's sometimes hard for me to be accurate with my timelines. But that doesn't mean that the pain I'm suffering with isn't real. Navigating the US healthcare system as someone who is neurodivergent has often felt like trying to explain fire to someone who has never seen it, felt it, or knows what heat is. Sometimes I feel like my complaints get dismissed because I don't respond the way that the expectation is, or that they are not prioritized because my answers might not be typical, or I'm trying to mask when I'm in the physician's office and trying to be what I believe to be a good patient. And when it comes to chronic pain affects over 50 million adults in the United States, and back pain is the leading cause of disability worldwide. So, not being able to accurately share how much pain I'm in with this situation really impacts how much work that I can do, even how well my recovery goes. Because studies show that multimodal therapy, trauma informed care when it comes to pain management, and even maybe adding in a little extra time into your patient load can be really helpful into getting to the root of the issue. But that's not the default in healthcare in the US because let's be honest, insurance protocols also push our doctors to tweak what they would recommend based on what insurance is trying to do. Insurance protocols often push pills and not people first care, or they push treatments that physicians will tell you they would not recommend, but it's simply the protocol they have to follow. We need better tools. We need better ability to navigate and provide care that is patient oriented, flexible timelines, understanding that not every patient is going to be like the patient before them, having more training in sensory and communication differences, particularly with the neurodivergent community, because I'll be honest, just getting myself into the mindset to go to a doctor's visit when you know it's going to be cold, there's the sensory issues. Doctors and hospitals tend to be very bright, very noisy, very overwhelming. And when you think about efficiency in medicine, inclusion is not just a checkbox. It's really about creating not just efficiency, but equity and saving lives. When we talk about diversity, equity, and inclusion, we don't talk about how much inclusion improves efficiency and creates systems that are easier to navigate, that reduce costs and actually increase compliance because they save lives. Um, and I'm not just asking for care, I'm asking to be heard. And I'm asking to be heard for all of those who sit in this space. My spine is held together by hardware. But what really holds me together in this journey of chronic pain is that one day someone in the system is going to hear me. Someone in the system is going to finally listen, and I'm going to get some relief from what has been almost 6 years of suffering with chronic pain from a treatment to my back and the ongoing issues and, struggles I've had with that.